Mental Health in Children Under 10 Years Old in New York City, created by Team B, Community and Public Health, Class Instructor Nina Bell, date September 15, 2014. New York City is making leaps and bounds when it comes to protecting children from abuse, even though they are faced with tough budget cuts. Secrecy surrounds child abuse investigations, and therefore it creates more mandated reports. When we think about child abuse, we think about neglect, but so many other types of abuse exist. Abuse is defined as any act or failure to act performed intentionally or knowingly causing harm to a child. Abuse can consist of inappropriate use of physical restraint, isolation, medication, or other means of harm. Mental health is not a type of abuse that you would think about in children, but as we find through research prevalent to 9/11, recent studies revealed higher than expected rates of mental health issues. Child abuse as well as child maltreatment are factors that contribute to mental health illness in children, as well as the child's environment. If all factors are present, the likelihood of the child to develop a mental illness is high. Children in foster care are especially vulnerable, being exposed to trauma and falling into the system, which usually involves protective services. Approximately 800,000 children are reported to be in foster care system nationwide. Children that grow up under these circumstances are at a greater risk of developing mental health issues. To address this issue, it is imperative that behavioral issues are adequately addressed in its early stages to avoid bigger and more devastating problems later in life. There's a substantial variation in results depending upon the methodological characteristics of studies. One study finds that 1/4 of youth experience a mental disorder in the last year, and 1/3 across their lifetime. One of the most common among this age group is anxiety disorders, followed by behavior disorders, mood disorders, and substance use disorders. Mental health issues are now being identified in child psychiatric epidemiology, including refinement of classification and assessment, inclusion of young children in epidemiological surveys, integration of child and adult psychiatric epidemiology, and evaluation of both mental and physical disorders in children. Essential Services of Public Health. Child Protective Services of New York was established in 1973, which helps children who have suffered from abuse or maltreatment. As stated before, child abuse also includes mental health, which is a type of abuse that has been growing. With that said, this law was established in New York, in which each county of New York is required to provide services to investigate child abuse and maltreatment of children. This is a free service to all children, parents, and other family members that area involved of suspected abuse and maltreatment. A statewide central register, also known as the hotline, is a telephone service in which victims can call freely to report the suspected abuse or treatment. The information is then relayed to the local child protective services for investigation. It's monitored their prompt response and identifies if prior reports of abuse or maltreatment have been reported of the suspected victim. The hotline is a service that is available 24 hours a day, 7 days a week. The Monroe County Office of Mental Health is a program that is committed to improving the health and quality of life of county residents that are affected by mental illness, developmental disabilities, alcohol, and other drugs. Each county of New York City provides service as well, but this division of services is funded by the government to allocate public mental hygiene funds in accordance with the New York State law. The program is a comprehensive plan for mental health, developmental disability, and alcohol and substance abuse services. Funding is allocated by local agencies based on community priorities, treatment outcomes, and program performance. It is also ensures coordination of services across levels of care amongst the providers within that community. Community mental health services are aimed at offering individuals and families treatment and support services that will assist them, avoiding unnecessary hospitalization or out-of-home placement, making help and treatment more affordable. Take Care New York is a policy agenda to improve the health of all New Yorkers, enabling them to live a healthier and longer life. This was originally launched in 2004 with a 4-year plan, which has made many accomplishments throughout that 4-year duration. With new strategies and goals launched, which was in 2012, Take Care New York targets and prioritizes 10 areas in order to improve the health status of all New Yorkers, advance health promoting policies and activities, and to create, sustain, and strengthen community collaborations. Take Care focuses on the mental health promotion, healthy children, and the youth. The program focuses on eliminating the barriers to treat individuals efficiently and effectively, which includes following up properly with the individual, the families, family engagement, and linkage to community support. Research has shown that the most crucial growth period in development for children is during the first 0 to 5 years of a child. The environment that the child is raised in affects his or her social emotional development, and negative experiences can impair a child's mental health, cognitive, and behavioral development. Therefore, children who come from families of abuse and neglect ultimately lead to development of mental health problems as well as other behavioral issues. Studies further showed that children in foster care programs are at greater risk for developing emotional and behavioral problems because they have experienced maltreatment and neglect before being placed in the system. With that said, to address this issue, the Child Abuse and Prevention Treatment Act, CAPTA, was developed as a federal policy in 2003, which requires child welfare agencies nationwide to have provision in place to identify and refer young children to early intervention services. CAPTA provides minimum standards for each state to incorporate in the statutory definitions of child abuse and neglect, and must mandate early intervention programs for children in child welfare that presents developmental delays. It also provides federal funding to states in support of prevention, assessment, investigation, prosecution, and treatment activities, and provides grants to public agencies as well as nonprofit organizations to help those who have suffered from child abuse and neglect. That means that facilities nationwide have access to federal funding as well as federal policies implemented to help prevent the development of mental health issues as well as treating those who present these symptoms. The City of New York has many different programs that also help children that have suffered from abuse or maltreatment. Programs such as Child Protective Services and the Monroe County Office of Mental Health focus on improving the health of New Yorkers, especially focusing on mental health, promoting the health of our youth and children. With the limited providers that focus on mental health issues in children, there has also been a push to adopt electronic health records. Implementing these information systems for quality assurance, accountability, and data sharing across providers, agencies, and counties. In doing so, it will allow providers near or far to communicate or patients to have access to care regardless of the limited facilities, or providers that state may or may not have. This system will allow for record sharing between facilities, while joint planning improves efficiency and quality of care. New York City also developed on-site school mental health programs, psychological counseling and therapy within schools. There are 70 schools serving across New York City, serving 50,000 children annually. New York State Office of Mental Health, the Department of Health and Mental Hygiene, and the Citizens Committee for Children at Mount Sinai School of Medicine have all worked together to provide an on-school mental health program. Engaging families and youth in their own treatment planning and decision is also being pushed to detect and treat early signs of mental health in children. Family support and family-based treatment are critical to children and youth resilience. Reaching out to the community stakeholders is to increase their awareness and knowledge regarding mental health issues, especially children from the foster care system. Children and families should be partners in formulating clinical service plans as well as clinical policies and services that impact their lives. A well-functioning system of care is needed for youth involved with numerous agencies and providers to achieve optimal outcomes. These values and approaches to a system of care are expressed in the Child and Adolescent Services Program and have been expanded in the New York City's Children's Plan, which reflects the goals of providing coordinated, collaborative services to youth and their families or caregivers. Important stakeholders such as the Federal Maternal and Child Health Bureau of the Health Resources and Services Administration and the Surgeon General's Office are on board with promoting concepts of family-centered, comprehensive, community-based, cultural competent systems of care, and a number of technical assistance, training, research, and policy centers are all supported by federal agencies. Therefore, within the city itself and federal-assisted stakeholders at all levels need to address adverse youth health outcomes through effective partnerships that require committed actions at state and community levels.